You have a clear indication of what EECP is and what patient should undergo EECP.
Yes.
So it looks like a great treatment, and your expertise in angiogenesis, what do you think this contribution of EECP would be the angiogenesis? Is there any clear evidence to show this new treatment called EECP has any effect on angiogenesis as per se?
Yes, the way EECP as a technology, the way it works is, it is external enhanced counter pulsation technology, where cuffs are applied to the lower extremity of the body, and while the heart is in a relaxation mode, the blood is pumped retrogradely upwards towards the heart. What it does is, it opens up the coronary arteries and microvessels of the heart, because you are pushing blood at 1.5 times its normal pressures. So, when you apply that kind of physiological pressures, you will open up microvessels. When you open up microvessels, angiogenesis will spurt open, and angiogenesis is a science of multiplication of growth factors stimulated and collateralizing and hyperperfusing that heart. So, angiogenesis is a well established science. EECP in the Western world is a very well established science. Insurance companies pay for it. Unfortunately, in insurance companies in India, they have not been educated to the point to give a coding or a reimbursement protocol for EECP. That must be done in India. I encourage EECP education to the insurance sector, so that insurance policy holders can advocate to their cardiologists and to their institutions that may I have EECP. The big stumbling block at the moment is, they are not able to tell their cardiologists because they are paying a very large insurance premium, but EECP is not offered to them. Once EECP is offered to that, the multiplication factor of patient enrollment for EECP in India will grow drastically, and eventual benefit with that. But the insurance company need to understand one fundamental fact. A, they are providing service to their customers, who are the premium paying customers. But B, they eventually, when a cumulative analysis will be done, they will find that they are saving money by EECP as opposed to other interventions. So it is going to be a business advantage for insurance companies to offer EECP to its customers and patients.
Oh, it's a very good point. So you seem like if EECP is reimbursed by the insurance company to the group of patients, there could be a huge saving for the insurance company as such.
Absolutely. At this moment, I speak to many Indian insurance companies, they do not understand this economics. They only know traditional therapies, well established therapies, because EECP they think is a luxury. They do not see the value proposition associated with EECP. They think, oh, this is going to be such a lot of money we are going to spend, why should we start reimbursing? So they sidetrack the patient from going into for EECP. But once they get convinced that if a patient gets EECP, they are not only going to get well, they are going to have good quality of life, but insurance company is going to save money. Now they are going to be much more profitable than before if they would offer EECP.
So you advocate a policy decision has to be done on the government level as well as the insurance level.
Well, I think government needs to implement EECP in government and municipal hospitals all across India, because that should become part of a cardiology departmental policy. Is how can we improve our department? And one of the first steps they can take is, let us bring in a heart failure program and let us begin offering EECP. In the private sector, wonderful hospitals like Fortis, Max, Apollo, and all of them, they should also consider incorporating EECP as an integral part of cardiovascular services within every hospital, because there will be patients within their patient pools who are not amicable to conventional therapies, but who can now be offered EECP rather than referring them to another center that offers EECP. It should be offered in-house itself.
Excellent, sir. I think you have given a very good view about interventional procedure and how a new evolving treatment should be properly positioned in the Indian market with the support of the government